Hi there. For my topic, we'll be talking about Depo Provera, which is an injectable form of birth control used in women. It is considered highly effective in preventing pregnancies. When used correctly, it results in only 1 in 100 chances of being pregnant. It is ineffective in preventing STI or STD, as there is no barrier between yourself and the STI or STD from your partner. It is a relatively long-term option, as it is only injected every 3 months. There are, of course, other forms of birth control that are only used every 5 years, like Mirena, but there are certainly others that are used every day, for instance, condoms or the pill. Full fertility will return in 10 to 12 months when you stop using Depo. Of course, you need to get through the first 3 months, but then you'd only have 7 to 9 months to go. There are no known harmful effects with continued use. So you could use this form of birth control every 3 months for multiple years at a time. The expense of Depo Provera is the initial exam is about $250, with the subsequent exams costing about $100. The good news is that insurance typically covers some or all of those fees. These are also available at Planned Parenthood. It is given in the form of a shot. And it works by releasing progesterone into your bloodstream, which prevents the eggs from leaving the ovaries and will thicken the cervical mucus. The advantages of using Depo Provera is that it is always ready to work. It can't be used wrong so long as it's administered every 3 months. And there's no daily maintenance. Some of the disadvantages could be the side effects. Irregular bleeding for the first 6 to 12 months and weight gain are the more typical side effects. There are less common side effects in change in sex drives, loss of hair, nausea, or depression. If I were to have a discussion with a friend of mine about the use of Depo Provera, I would certainly recommend that they speak to their doctor. Outside of that, I would also recommend that they go ahead and schedule their appointments for their booster injections a year or 2 years in advance. It'll help keep them on track and make sure that they're always on time. I gathered my information on Depo Provera from this website, plannedparenthood.org. They have a lot of information on several different types of birth control. One Google image that I found particularly fascinating was this right here. Depo Provera. It's like being immune to sperm. Thanks for sharing a few moments with me and discussing Depo Provera as a form of birth control. Thank you.